Good morning, afternoon, everyone. My name is Joya Sayande. I am a registered nurse with an MSN and also a licensed public health nurse. I am the nurse manager here at Apex Adult Residential Homes. I am glad that you all can join this nurse training session on blood pressure monitoring, hypertension, and danger signs of hypertension. The objectives of this training are to make sure all staff participants can accurately measure and record blood pressure using digital devices, understand normal and abnormal BP ranges, recognize clinical signs and symptoms indicating danger in hypertensive patients, respond appropriately to abnormal findings and emergencies. Let's begin with the introduction to blood pressure. Definition: blood pressure is the force of blood against the arterial walls as the heart pumps. Blood pressure has two components. 1. Systolic BP, pressure when the heart contracts. 2. Diastolic BP, pressure when the heart relaxes. Normal blood pressure ranges for adults 120 systolic over 80 diastolic. Elevated blood pressure is any reading of 120 over 129. Let's discuss the step-by-step procedure for measuring blood pressure. The first step is to ask the resident to sit in a chair with an armrest at a table, with your arm supported at heart level, palm facing up, and arm relaxed, not tensed. Keep the monitor on a stable surface, don't hold it in your lap. Applying an upper arm cuff. Place the cuff 2 to 3 centimeters, about 1 finger's width, above the elbow crease. Align the cuff's tube over the inside center of your arm, over the brachial artery. Wrap snugly. 2 fingers should fit easily under the cuff. Press start. Stay still, quiet, and breathe normally. The cuff will inflate, then slowly deflate. The resident will feel pressure for approximately 20-40 seconds. Wait for the readings to appear: systolic, diastolic, and pulse. Also, at this juncture, let me highlight common mistakes to avoid when measuring blood pressure. Avoid talking, texting, or moving during measurement. Make sure not to cross legs or feet dangling. Make sure the arm is unsupported or below the heart level. Do not measure over clothing. Do not use the wrong cuff size or a loose/over-tight cuff. Having said that, now let's identify the danger zone for residents with high blood pressure. Danger signs in hypertensive patients. Red flag symptoms to look for: severe headache or dizziness, blurred vision or sudden vision loss, chest pain or shortness of breath, confusion or slurred speech are signs of a possible stroke, nosebleeds, swelling of the face, hands, or feet, nausea or vomiting, seizures or sudden weakness/numbness. Let's identify when to contact emergency services. It is highly recommended that you contact the doctor immediately, or an urgent care or an emergency center if the BP readings are 180 over 120. Also, if you observe any signs of confusion, vision changes, breathlessness, seizures, or neurological deficits, or the resident becomes unconscious, collapses, or if there is sudden chest pain or signs of stroke, such as face drooping, arm weakness, speech difficulty, then this is surely the time to call the emergency. In conclusion, remember that numbers tell a story, but a caring staff gives them meaning. You are the first line of care for our residents. Remember, behind every BP reading is a person with hopes, fears, and a heartbeat that trusts you to protect it. Try to be calm, because your calmness saves lives. In emergencies, your composure, knowledge, and quick response bring order where others see panic. Thanks for attending this training. Thanks for all the care you provide.